Countries detecting the Omicron variant are increasing by the day. Latest figures show no less than 35 countries have recorded a COVID infection by the fifth variant of concern. 4 of them belong to the Western Pacific region: Australia, Hong Kong, Japan, and the Republic of Korea. But the World Health Organization thinks the variant is already spreading in other countries.
The number of countries with Omicron circulating in the Western Pacific is already likely to be much higher than this, and as we are seeing an increasing number of reports globally, I think our region may also see an increase in the number of countries that report it over time.
While current measures are still seen to be effective in responding to the pandemic, the WHO says available information suggests that the Omicron variant is more transmissible.
The data suggests that potentially higher transmissibility. So what is very important is to prepare and be ready for this next surge.
14 countries are currently in the Philippines' red list. But the WHO says travel restrictions will not prevent but only delay the entry of Omicron.
It's not possible to completely stop the virus unless you completely close the border, which has a significant impact. And therefore, what is important is that we should not be complacent because of the border control, or we should not just rely on the border control.
As a matter of fact, travelers from South Africa have entered the country right before the government imposed restrictions. More than 250 have arrived from South Africa between November 15 to 29, who are all being closely monitored by the Bureau of Quarantine.
BOQ has started to locate these passengers. No positive case was reported on retest, while the 3 foreign nationals from Region 6 tested negative on RT-PCR retest last December 1. The 3 South African nationals who arrived in Negros Occidental last November 25 and 26 are all fully vaccinated and are all currently asymptomatic. They are all undergoing quarantine in rented houses and have underwent re-swabbing last December 1 with pending test results.
Vergeire adds 1 passenger each from South Africa, Burkina Faso, and Egypt have tested positive for COVID. Their samples are currently being assessed if eligible for genome sequencing. Burkina Faso and Egypt are not part of the red list.
Hindi po tayo magsasara and to isolate Philippines sa rest of the world. The threat is there, but if we are prepared, we can be assured that we will be protected.
It still remains to be seen if Omicron causes more severe disease and if it drastically reduces a vaccine's efficacy. This is why vaccination remains important.
We know that the vaccines continue to be highly effective against protecting individuals against severe disease, hospitalization, and death. And our focus should have to remain about ensuring that individuals who are unvaccinated are protected from these outcomes.
Both the DOH and the WHO say that the Philippines has learned so much from the recent Delta-fueled surge. Lessons which will spell the difference between properly managing or bowing down to Omicron once it enters the country.